roadmap. What are the requirements that we do and need and everything. So first thing, to all the people who are still doing MBBS, doing CRR and everything, for all the people doing MBBS, I would say complete a final year and then start working towards your German language and so on. Don't start learning. There are a lot of people who spoke to me and they are doing final year or third year and they said, I want to learn German language now. I would say go ahead, learn. But once you complete everything and then you don't have much time to do in MBBS itself, like you have a lot to learn and everything when you have a lot to do. Once you even complete learning the language by your third year or fourth year, by the time you complete CRRI and your documents are processed, and then when you come to Germany, you forget the language. When you forget the language, it's not going to be, you can't think it's okay, I'll just take the books, I'll revise, and no, that's not how it's not going to work like that, because it's completely different. The language is completely different. The verb positions and the things which we use in English is completely different in German. So the verbs come at the end, they don't come in between. So it's a different language once you start learning. So I would say plan yourself from CRRI. That's when I actually started, and because of COVID, everything got messed up. But so I would say you can start from CRRI and make sure that your degree, which you get from your medical college or whichever university it's affiliated to, you can check in this AIIMS website. Yeah. So this is this AIIMS website. You can type it in Google. You can just type AIIMS, and there will be a website. You can take a screenshot of this PPT also, and I think it will also be posted on IMAJD and YouTube's channel also. You can check this later also again, but you can just check whether your college or your university is recognized by the German college. Most of the NMC recognized college in India are recognized by German Medical Council also. But although you can check once again, some of them, very, very few, exceptionally very few, are not recognized. You can just check your colleges, but most of the colleges are recognized. You don't have to worry about it. And when they are recognized, I'm sorry, I have no idea about it. You can I'll tell you about whom to ask and all those things. So whether you need a good CV, I would say your work experience matters a lot when you want to plan immediately. So we Indians always have a plan of doing everything fast. So we want to complete our CRRI and immediately after CRRI we want to jump to the PG. But in India it's okay. But when you come to Germany, they'll see that you don't have work experience. Internship is not considered work experience. And when you complete only internship, when you don't have much of clinical experience from India and you want to come into a foreign country with a foreign language and you want to work in a foreign healthcare system, it's going to be too much. It's going to be too much. You have to speak in German. You have to think so much when you're going to talk in German. Because your mind will be very busy with thinking about how to bring the language out from your mouth, and also you have to think about what you have to treat with the patient and everything. So I would say please work for a minimum of 1 to 2 years in India and then come to Germany, so that you have some amount of clinical experience, at least some amount of clinical experience, and then when you come to Germany you will know. And I would say work in a hospital where you are able to do something clinically rather than only most of them when they're preparing for USMLE or PLAB, they want to go to hospitals. We know that there are many hospitals that are not much of patient load. We just want to sit and study and have some amount of income. I would say try to go to a hospital where you are able to see patients, treat patients, or be a part of the team to see what's happening and how the patients are being treated, so that you know what's happening. And when you come to Germany, it's going to be a little easier because we are expected directly to start with IV Venflons, with reanimation, CPR, and so on. Yeah, so it's better to have some amount of work experience, minimum of 1 to 2 years when you're in India. Please don't jump directly from CRI to Germany. It's not going to be easy. It's going to be a tough road, even to get PG positions or jobs also. Yeah. Research and volunteering, they're all extra. So they're all extra. When you do research and volunteering, it's all only extra. Main thing is the language and the work experience. When you have zero research papers, zero volunteering experience, it's okay. It's completely okay. It's not like going to be like USMLE, where even USMLE, they only have 1 or 2 points, not much. But the language and the work experience is very important. So next, coming to finance. When you're applying for the visa here in India, for the German visa, you'll be applying firstly for the employment visa for the recognition of foreign professional qualifications. This is a particular visa which is called 16D. D for Delhi, 16D, D for Delhi, 16D visa. You can Google up in Google it's later also. You can just write 16D Germany, and then you will see there's a visa called employment visa, recognition of foreign professional qualifications. So that is the visa you'll be applying for, where you'll require blocked account, which is 1,033 euros currently, which is so you need to have 1,033 euros, which is close to 10 lakhs rupees. So you need to transfer 10 lakh rupees to one of the block account issuing companies or service providers. You will have to transfer to them, and then when you come to Germany and open a bank account here, they will start putting 1033 euros per month in your German bank account. So that is for the initial expenses until you clear your licensing exam and so on. Okay, and then next is the language. So there are a total of 6 levels of language in Germany, starting from A1, A2, B1, B2, C1, C2. Minimum B1 or B2 language certificate is needed when you are applying for the visa, and the minimum B2 level of certificate is required for the medical license exam here in Germany. So you can take a quick screenshot of the documents which are going to be needed later. So the way you apply here for Germany, it's going to be like, you have to apply to particular state. You have to decide which state you're going to, and say for example, there are so many states in Germany, so you need to decide which state you're going to, and there are so many statistics about it. Almost all state medical councils will require these certificates. There'll be plus or minus for each state medical council. In Germany, when you're applying to the residency or even for anything, you have to apply to state medical council. There's no particular, for UK you have general medical council. No, there's nothing like that for Germany. You have to apply to the particular state medical council, whichever state you wish to go, and they will ask for these documents. So these documents you have to get it. So see that there's going to be MBBS degree certificate, you need your internship completion certificate, and so on. So all the MBBS students who are here thinking that you can start it right away, no, you don't. That's what I'm saying. Please wait. For Germany, we need a lot of patience. It's not that easy. Please don't jump into and think that, I'll start it right away. And please hold your horses down and complete your internship properly and then start your work. But you can start learning the language from internship. You need an internship completion certificate, state medical council registration certificate. There's a license certificate, from India, and good standing certificate from the state medical council, whichever state medical council you're registered at. And these two certificates, the passport police clearance certificate and the good standing certificate, are valid only for 3 months. You need to time it properly so that it reaches German state medical council on time and not later than 3 months. Those all will be decided on a later date. Will be explained on a later date. If at all you all have doubts, you can approach your IMA and representatives, and probably if needed, they can organize another session for particular doubts on how to apply and everything, because application to Germany residence program is not so popular like how for USMLE and PLAB. There are so many YouTube channels or so many people to guide through. For Germany, there are not much, and it's not particularly told also. It's not that open also. That can be later organized. So make sure your passport name is the same in your birth certificate, in your MBBS or PG degree certificate, and your mark sheets and so on, and everywhere. I would also suggest to have your name, your expanded name. If you have any initials in your name, please expand them and have them the same in your passport, Aadhaar card, voter ID, whatever document, whatever ID you have in India, and also in all the certificates. If at all not, you can apply for them now before it's too late. You can apply for them now and make sure that it's all the same. You can prepare all those documents and all. So make sure that your name, it's the same when you have your initial at the first or the end. I would say have the passport as the standard, and with that, make sure that you have all the others the same. Like the first name and the last name should be the same in all the other certificates and documents, including your Aadhaar card. It's better you change it before you leave India. And then after you have all these documents, you need to attest it. So that means you have to send the documents to embassy. They will attest telling that the originals and the copies are the same. You have to send these copies to a translator who will translate all your certificates, including your passport copies. All the copies, I mean, not the original copies, original ones. I mean the Xerox copies, which are attested from the embassy, German embassy. They will have to be translated, and only after translation it has to be sent to German State Medical Council.